I spent last week trying to secure a statement from this government on the Cass review and puberty-suppressing hormones. Every single attempt was voted down or refused. Finally, after confirmation from the Health Board of a pause in puberty-suppressing hormones for new patients, we have a statement today. But I don't know why the Minister bothered, because this will offer no comfort whatsoever to families who have been failed by gender care services in Scotland. The Scottish Government's direction of travel on this vitally important issue is as clear as mud. The statement today does not confirm whether this Government will implement any of the 32 recommendations, nor does it address the cut to gender care services. This Government claims that it supports young people experiencing gender distress, yet it has members of its own government who have publicly dismissed the findings of an evidence-based expert report. Today's exercise in kicking the can down the road and stalling for more time shows that they are more concerned about holding together their fragile pact with the dogmatic Greens than it does of the health care for vulnerable young people. So, can I ask the Minister, when will parents and young people receive a meaningful update? And can she assure Parliament that all government ministers will follow the science rather than ideology?
Minister.
I thank Megan Gallagher for her question. I would note that this has been a review that was commissioned by the NHS in England. We have worked with that review, but Scottish pathways have not been included in the review. The Scottish Government has clearly welcomed the report from Dr Hilary Cass, and I think what is absolutely clear is that the decision-making has been for clinicians to make, not politicians. And these decisions should be, as I said in my statement, always be made carefully based on the best evidence available. I am looking at this and putting the children and the families that are needing this support at the heart of the way that I'm working forward, and I'm getting the best advice I can from clinicians and stakeholders.
Jackie Bailey.
I thank the Minister for advance sight of her statement, although I have to register my disappointment at the lack of substance. The Cass report is a 4-year-long piece of work that is evidence-based, informed by expert clinicians and by those with lived experience, so it deserves to be treated seriously. Yet this statement feels more like a sop to the Greens to keep the Bute House agreement alive. Does the Minister agree with Patrick Harvie when he says that he doesn't believe that this is a valid scientific document? Dr Cass has been discussing her report with clinicians and government in Scotland since 2022, and instead of acting, the Scottish Government appear to be setting up yet another working group. Now, we already have the National Gender Identity Healthcare Reference Group. Is the Minister bypassing this with something new, and if so, can she explain why? And finally, can the Minister confirm that she will suspend the commissioning of the Young People's Gender Service until the recommendations are fully considered?
Minister.
I thank Jackie Bailey for her question. I repeat again, there are 32 recommendations in an almost 400-page report, and we are working through that at the right speed to ensure we make the right decisions. And that is from a clinical perspective, as I have said. As I said in response to Megan Gallagher, the Scottish Government welcomed the report. I have been reading it, and I recognise that Dr Cass is an eminent paediatric physician. I am listening to my clinicians with regards to this, and as I've said before, also the stakeholders.
Presiding Officer, some members of the SNP and Green Government have questioned the integrity of the evidence in the Cass report. And given that gender identity healthcare is a key part of the Bute House agreement, and government spokespeople are publicly discrediting it, for the sake of young and vulnerable people, will the Minister now consider ditching the Bute House agreement coalition of chaos?
Minister.
I am here to speak directly to the young children and their families that have been impacted by this decision. I want to find the best way through for them, and that's why I'm working closely with the clinicians in NHS Scotland and also researchers.
Well done. Fulton McGregor, to be followed by Carol Mochan.
Thank you, Presiding Officer. This review is clearly important and very detailed and requires further detailed consideration. However, we must remind ourselves, as the Minister has said, that it does focus on services in NHS England and not NHS Scotland. So does the Minister agree that regardless of anyone's position on this matter, it is essential that adequate time is taken to consider the report and that any knee-jerk reactions, one way or the other, are avoided?
Minister.
Thank you, Fulton McGregor. As I've said, it is a 400-page report, and a knee-jerk reaction concerning a health system, a knee-jerk reaction on a report that concerns a health system different to Scotland's will not, in my view, be helpful for either patients or their families. That said, of course, it's vitally important that these recommendations are carefully considered to assess whether and to what extent they are relevant to the approach to gender identity healthcare in Scotland, and to consider what steps may need to be taken as a result.
Carol Mochan, to be followed by Claire Hawley. Thank
you, Presiding Officer. Can I thank the Minister for her statement and agree that it is right that we proceed carefully and compassionately. Can I ask the Minister, given Dr Cass's report is one founded on strong scientific evidence, and there were interim recommendations, so we did see what was coming to us in this Parliament, why the Government cannot be clearer in outlining its position on whether it believes all recommendations ought to be implemented, or does she believe that sitting on the fence to protect the stability of the Bute House agreement is a tenable position?
Minister.
And further to this, on the point of timescales.
I thank Carol Mochan for the support in recognising that we need to take time to review the contents of the report. As I've pointed out on a couple of occasions, this was an English NHS England commissioned report looking at England. Not all the recommendations link back to Scotland. That's why we're taking the time.
Many young people will be concerned about the effect of last week's decision to pause the prescriptions of hormones on their healthcare journey, and our solidarity should be with them. We need to work as quickly as possible to ensure that the concerns of the clinicians are resolved so that they can provide this care with confidence. Scottish Trans have suggested that we should consider setting up our own research study. Can the Minister outline what steps the Government is taking to resolve the current situation and how we can ensure that lived experience is at the heart of any action going forward?
Minister.
Thank you. I'd like to start by thanking Ms Mackay for her engagement on this and her shared concern for the young people most impacted by this change. As I highlighted in my statement, NHS Scotland are already engaging with NHS England's research study regarding puberty blockers as an observer, and discussions are ongoing between clinical stakeholders on what further involvement may be appropriate. The Chief Scientist Office within Scottish Government is also involved, given their expertise in clinical research, and I hope we will be able to update Parliament on the outcome of these discussions soon. In addition to the NHS England research study, we have already provided grant funding to the University of Glasgow, as I mentioned to Mr Cole-Hamilton. Hearing from those with lived experience of accessing or waiting to access gender identity healthcare is vital. To support our national work to improve these services, we have put in place a lived experience coordinator to engage and consult with trans communities across Scotland. And as I laid out in my statement, I remain absolutely committed to my own engagement with young people affected.
Rose McCall, to be followed by John Mason.
Thank you. The Cass review highlights the clear acknowledgement of detransition, and it's as a growing phenomenon that cannot be ignored. In fact, it was mentioned in the report over 80 times. I noticed from the statement today that the Chief Medical Officer and the Scottish Government will take time to assess the recommendations, which is yet more time in an already lengthy period, as detransitioners have largely been ignored, often victimised and repeatedly castigated. So may I ask the Minister, is detransitioning included in any of the work already commissioned by the Scottish Government? Will it be included in any additional work commissioned, including the roundtable that the Minister has mentioned in her statement? And when will Parliament be updated on plans to support detransitioners?
Minister.
I thank Rose McCall for her question. As I noted, the Chief Medical Officer has agreed to update Parliament by writing on the clinical side before summer recess. detransitioning, given that we're talking about what was contained in the Cass review, detransitioning, I think, should be included, and I will ensure that I feed this back to the Chief Medical Officer to ensure it is.
John Mason, to be followed by Sue Webber.
Thank you very much. One of Dr Cass's main criticisms of the system in England was a failure to reliably collect even the most basic data. And also she said that NHS adult gender services initially refused to cooperate in sharing data. Can the Minister assure us that that is not the case in Scotland?
Minister.
So I thank John Mason for his question. I cannot comment on specific data systems or collection in NHS England commissioned services. However, we are committed to improving data collection for gender identity healthcare in Scotland. As I mentioned, Public Health Scotland have been commissioned to develop quarterly aggregate data collection for NHS gender identity clinic waiting times, focusing on a number of new referrals and length of wait from initial referral to first outpatient consultation with a specialist. Whilst this is a technical commission, the detail of which is being worked through by Public Health Scotland and territorial health boards, Public Health Scotland currently intend to publish the first of this information in late summer 2024.
Michelle Thompson, to be followed by Pam Gossel.
Thank you, Presiding Officer. The Tavistock Clinic based in London is facing mass legal action claims where some young people felt they were being rushed into a medical pathway. Given that the Sandyford Clinic in Scotland uses the same guidelines, what assessment or indeed discussions with NHS bodies have the Scottish Government had as to the possibility of that similar legal action occurring in Scotland?
Minister.
I thank Michelle Thompson for her question. I have had no discussions on this topic, but bear in mind what she said and will respond to her in writing.
Pam Gossel, to be followed by Regan.
Thank you, Presiding Officer. Women's rights groups from across Scotland and the rest of the UK have welcomed the findings of the Cass review. However, last year, the then First Minister said that some of those opposed to her government's gender reforms cloak themselves in women's rights to make it acceptable. But just as they are transphobic, you'll also find that they are deeply misogynistic, often homophobic, possibly some of them racist as well. Does the First Minister agree with this assertion, and does she believe that those opposed to gender reform and to children transitioning are misogynistic, homophobic and racist?
Minister.
I'm responding as Minister for Public Health and Women's Health to Pam Gossel's question. I am focusing today on ensuring that the children and the families that have been impacted by the decision this last week and also the clinicians get the right support to ensure that we make the right decisions and get the best gender services that we can have in Scotland.
Thank you. And Regan.
Thank you. Given the importance of this issue, the public would rightly expect that the First Minister or the Health Secretary would be making this statement. On the 28th of March, I asked the Health Secretary to pause puberty blockers in Scotland, and now it seems that the Cabinet Secretary was unaware that clinicians at Sandyford had made the decision to stop in mid-March. Can the Minister confirm when the Government will be scheduling a full debate on the comprehensive findings of the Cass report and its many implications for health, for education and for law in Scotland? And listening to the Minister today, it seems as if the Government has not read or not absorbed Cass's conclusions. Is the Government really saying that they do not accept the recommendations in full?
Minister.
I thank Regan for her question. And as I've pointed out in previous answers, this was a report commissioned by NHS England looking at services in England. As a result, not all recommendations fit with the way and the pathways that we have within Scotland.